There's been another massive jump in COVID-19 infections countrywide. Almost 27,000 new infections were recorded just yesterday, and Gauteng still leads that surge with over 8,000 new cases. It's then followed by KwaZulu-Natal with just under 6,000 new infections. And the Western Cape, well, they're coming in third with over 4,400. And the Northern Cape is the only province still below the 1,000 mark with just over 600 cases. And sadly, 54 more people have died, taking the death toll to 90,226. That positivity rate as well, however, dropping to 32.2%. Well, KwaZulu-Natal health officials are concerned about the surge of infections within the province, and they are urging people to adhere to non-pharmaceutical interventions to curb the spread. In the last 24 hours alone, the province recorded almost 6,000 cases.
We are concerned with any and every new case that we get as a province, because each time we get a new case, we know that there were contacts of that case, and every case therefore says to us we must trace the contacts of that case and see whether they are positive or negative. So that's a concern in itself. The second reason we are concerned is that with each case we have to check the prognosis and see whether our resources are going to be required to be spent on that case and other cases related to it. And remember, we are speaking of COVID-19 levels going up at a time of holidays, and the accidents may go up as well. So all those are concerns. At the same time, we can report that we are ready. We have been ready since the other waves that we've been going through as a province and as a country, and we have enough beds so far. If we look at the numbers of people that are admitted and the numbers of the people that are active, very few are admitted, both in the public and the private sector. So we are ready at that level. We also do have a number of human resources that we have contracted until next year, who we also are going to be using should a need arise. However, we are worried because they themselves do get to be infected. So we really are very, very much cautious. Hence, we are saying people must still go back and adhere to the non-pharmaceutical interventions.
Well, many countries are rolling out COVID-19 booster shots, and this is part of attempts to combat the new Omicron variant that's currently sweeping the globe. Vaccinologist Professor Shabir Madi says that the elderly and those with underlying conditions should be targeted. He further says mixing and matching vaccines offers more protection.
If you're trying to prevent infection, you're probably worthwhile going for a third dose, but we're not trying to prevent infections in South Africa or in most of the rest of the world, except some high-income countries that have ordered vaccines. What we are trying to prevent is severe disease and death. And when it comes to prevention of severe disease and death, the group that will benefit the most from a third dose of vaccine, and for the Johnson & Johnson vaccine, certainly they should get a Pfizer boost. And I need to be explicit about that, based on the data around Omicron as well. Individuals that receive a single dose of the Johnson & Johnson vaccine should get a Pfizer dose as a boost. And the reason there is that by targeting high-risk individuals, we'll be able to improve the protection against severe disease, say from 70% to 80 and 90% with that third dose. So giving it to people above the age of 65, giving it to people with underlying medical conditions that causes their immune systems to be suppressed, those are the groups we need to target, that have already received 2 doses of Pfizer with an additional dose of Pfizer. And as for anyone that receives a single dose of the Johnson & Johnson vaccine, the data are extremely strong that the heterologous approach works better than a homologous approach, which means Johnson & Johnson followed by Pfizer will likely produce much better protection and certainly induces much better immune responses than 2 doses of the Johnson & Johnson vaccine.